Depression is a common but very serious mood disorder that negatively affects how you feel, the way you think, and how you act. Depression causes feelings of sadness and can lead to a loss of interest in activities that you used to enjoy. It can lead to a variety of emotional and physical problems and can decrease your ability to function at work and at home. Fortunately, it's very treatable. I'm Camilla, I'm a psychologist, and I'm on a mission to spread mental health awareness and make better mental well-being available to more people. In this video, we'll be taking a closer look at depression, what it is, how to spot it, how to treat it, and perhaps most importantly, what we can do ourselves to reduce the symptoms of depression, and how we can help people close to us who may be struggling with depression. So what is depression? Depression is also sometimes referred to as major depressive disorder or clinical depression. It's a mental health disorder that affects both how we think, feel, and behave. It can often cause feelings of sadness, hopelessness, and worthlessness. The symptoms of depression can be really debilitating and can make it difficult to carry out daily activities. That can be things like going to work, going to school, getting the chores done around the house, or even just getting out of bed. So when we look at the symptoms and the diagnostic criteria for depression, they can really vary depending on the severity of depression. The symptoms include feeling sad or feeling generally down, experiencing a loss of interest or pleasures in activities that you used to enjoy, seeing changes in your appetite. So that can either be an increase or a decrease in appetite, and it can sometimes result in weight gain or weight loss without a conscious effort of doing so. Changes in sleep habits. Now again, this can either be having trouble sleeping or sleeping too much. The important thing here is really to notice the changes. We might experience a loss of energy or a general increased fatigue. Another symptom is feeling worthless or feeling guilty even when there's nothing to feel guilty for. We might experience difficulties thinking, concentrating, or making decisions. Generally, all the cognitive function. We might see an increase in purposeless activities. That can be things like the inability to sit still, pacing, generally fidgeting. Or we might see the opposite, a slowing in movements and speech. Both of these have to be severe enough that the changes can actually be observed by other people. And finally, in severe cases, we might experience thoughts of suicide and death. When we screen for and diagnose depression, we do it according to diagnostic criteria. So we'll typically ask things like when the symptoms began, how long they last, how often they occur, and if they're keeping you from going out or doing your normal activities. Symptoms have to have been present for at least 2 weeks, and there must be a change compared to your normal level of functioning. We can differentiate between mild, moderate, and severe depressions. All three severities of depression can be treated. Now, just a quick note, there are some other medical conditions, such as thyroid problems, brain tumors, and vitamin deficiencies that can cause the same symptoms as depression. It's really important to rule out any other medical conditions before assuming that the symptoms are due to depression. Therefore, it's really important that you always go to see your healthcare provider, your doctor, if you're experiencing these symptoms or if you're generally worried about your health. Why do people get depression? Depression is one of the most common mental disorders in the world. According to the World Health Organization, 5% of all adults globally suffer from depression. Depression can occur at any point during our lives, but statistically speaking, we tend to see that it first appears when we're in our late teens to mid-20s. Also, statistically speaking, we know that women are more likely to experience depression than men are. Some studies suggest that a staggering third of all women will experience a major depressive episode in their lifetime. So if we try and understand why we get depression, it's important to note that it's a complex mental disorder and that it can be caused by a variety of factors. Research suggests that genetics, biological, environmental, and psychological factors all play a role in the onset of depression. Some of the most common causes of depression are genetics. Research has showed us that depression can run in families. People with a family history of depression are more likely to develop the condition themselves. Biology and brain chemistry. Depression has also been linked with imbalances of certain chemicals in the brain. These are chemicals like the neurotransmitters serotonin, dopamine, and noradrenaline, which we know are all involved in regulating our mood. Environmental factors. These can be traumatic events such as losing a loved one, losing a job, going through a tough breakup, or physical and emotional abuse. These are all examples of things that environmentally can trigger a depression. It's important to note that we do differentiate between grief over losing a loved one, for example, and depression. The two are not the same, but they can coexist. We also see that long-term stress and exposure to stressful life events can contribute to the development of depression. There are many overlaps in the symptoms between stress, anxiety, and depression, and we often see the three coexist. The final common cause of depression I've chosen to include here today is substance abuse. We know that drug and alcohol abuse can increase the risk of developing depression. Substance abuse can also make it more difficult to treat a depression. What we sometimes see is that someone suffering from depression might be more likely to self-medicate using drugs or alcohol, which in turn worsens the depressive symptoms. This is where we can sometimes see a creation of a vicious cycle of substance abuse and depression that can be really difficult to break out of again. It's really important to note that depression is not a sign of weakness or personal failing. It's a real, treatable medical condition that can affect anybody, regardless of age, gender, or background. Let's talk about the treatment of depression. It's really important to remember that depression is a treatable condition. In fact, depression is one of the most treatable mental disorders. Between 80 and 90% of people with depression respond well to treatment, and almost all patients with depression experience some relief of symptoms. Generally speaking, the earlier treatment begins, the more effective it is. There are a few different treatment options for depression. The most common two are medication and therapy. For mild depression, psychotherapy can often be used as a standalone treatment. For moderate and severe depression, we often see a combination of medicine and therapy for the best results. So let's quickly talk about these two treatment options. For the first, medication. Antidepressants are the most common form of medication to treat depression. Antidepressants may help regulate the chemicals in the brain that control our mood. So they work by increasing these chemicals in the brain that we call neurotransmitters. Serotonin is an example of this, and we know that this plays a role in controlling our mood and emotions. It's important to know that antidepressants take time to work. Actually, they take between 4 to 8 weeks. And we'll often see that other symptoms such as difficulty sleeping, the appetite, the difficulties concentrating may improve before we start seeing our mood improving. So it's really important to give the medication time before deciding whether it works or not. I recently had a client who had just started on antidepressants just a couple of days ago and was already feeling these amazing effects of how his mood had lifted and how everything was suddenly better. This to say that sometimes taking the steps and knowing that you're actually entering into treatment can in and of itself help us feel better. That, and maybe a bit of placebo effect at play here, but that's a topic for another video. Now, another thing that I just want to quickly say is that if you or anybody you know start on antidepressants, it's really important to not stop them again without consulting your doctor first. I sometimes see that people start to feel better after taking antidepressants for a while, decide to stop them themselves, and then experience a relapse into worse depression again. When you and your healthcare provider decide that it's time to stop taking the antidepressants, they'll guide you how to slowly and safely decrease your dose. Stopping them abruptly can cause withdrawal symptoms. Psychotherapy. Psychotherapy teaches people with depression new ways of thinking and behaving, and it can help with changing habits that contribute to depression. Psychotherapy can either happen in a one-to-one setting or in a group setting. Two effective psychotherapies in treating depression include cognitive behavioral therapy, CBT for short, and interpersonal therapy, IPT for short. With CBT, people learn to challenge and change unhelpful thinking patterns and behaviors to improve the depressive and anxious symptoms. I talk much more about the basics of CBT in this video. You can go check that out next if you want to learn more about this therapeutic approach. IPT focuses on interpersonal and life events that affect our mood. The goal of IPT is to help improve the communication skills within relationships, establish social support networks, and to develop realistic expectations of how to deal with difficult situations in life that may be contributing or worsening the depression. Depending on the severity of the depression, psychotherapeutic treatment for depression can take anywhere between a few weeks to much longer. In many cases, we see significant improvements in about 10 to 15 sessions. Finally, in some cases of severe depression where the patient hasn't responded well to the other treatment forms, electroconvulsive therapy, or ECT for short, may also be an option that's worth exploring. This treatment form involves a brief electrical stimulation of the brain while the patient is under anesthesia. A patient typically receives ECT 2 to 3 times a week for a total of 6 to 12 treatments. Things you can do yourself to decrease the symptoms of depression. There's actually a number of things we can do to reduce the symptoms of depression. I'll give you a few examples here that you can try and implement in your life if you're not already doing them. These are all things that are generally just good for our mental well-being, our mental health. So even if you're not suffering from depression, even if you're not seeing these symptoms, These are good habits to bring into your life. Make sure you get some physical activity. As little as 5 minutes of exercise a day can make a difference in our mental health, and just going out for a walk can really boost our mood. For most people, regular exercise helps create good feelings and improve our mood. Try to maintain a regular bedtime and wake-up time. Getting enough good quality sleep on a regular basis is important for our mental health and can reduce the symptoms of depression. Make sure to eat healthy and regular meals. All these first 3 points have really been focusing on our physical body, but we know there's a really strong link between how we're feeling physically and how we're feeling mentally. Healthy body, healthy mind, the two go together. Try to connect with other people, and if you are feeling under pressure, if you are feeling some of these symptoms, make sure you talk to someone about how you're feeling. We know that social support is a major protective factor in our mental health, and that it can help to reduce symptoms of depression. The final one I've chosen to include here is to avoid the use of alcohol, drugs, and nicotine. How can you help a loved one who's depressed? If you know someone who's struggling with depression, try and help them and support them in taking the step to seeing the healthcare provider. But some of the things you can also do to support them are to offer support, understanding, patience, and encouragement, to take the initiative to invite them out for walks, outings, or other activities, to support them in sticking to the treatment plan, for example by helping them set reminders to take prescribed medications. Help them make sure that they've got transportation to get to their therapy appointments, and remind them and encourage them that with time and treatment, depression will lift. If you're recognizing the symptoms of depression and you're worried about your mental health, please see your healthcare provider. You are not alone, and most importantly, you don't have to keep feeling like this. Depression is very treatable, but the first important step is to talk to someone about it. Maybe you can start off by sharing how you're feeling with someone close to you, and they can support you in taking that next step. I explain new psychological topics on this channel every single week. Subscribe to not miss out on the next one. If there's any topic you'd like me to cover within psychology, please leave it in a comment down below and I'll look at it. If you found this helpful in any way, please give the video a like so it might reach more people who need to see it. Thank you for watching. I hope to see you next time. Take care and bye for now.